Welcome. Hello to Virtua's Health's Real Talk Women's Health Chat. My name is Nicole Michalik from 92.5 XTU. Super excited as always to be your host. It's one of my favorite things to do, bringing all these smart, intelligent, compassionate women together to make things better and easier for you. And I'm excited to get started. So, a few helpful hints for tonight's session. Your camera and microphone are turned off, but you can still ask our panelists questions through the Q&A tab. So you can choose to submit your question anonymously if that makes you feel more comfortably, and our experts will answer your questions toward the end of the session. And a number of you have already submitted your questions toward the end of the session. So when you registered, our experts, we have that. We're excited. We're ready for that. Okay, so if you prefer to have closed captions on, click the live transcript button at the bottom of the Zoom. Okay. And then you're going to click show subtitle, and you can adjust the size of the font by clicking on subtitle settings, as you can see here with the yellow arrow. You should see the closed captions at the bottom of the screen. Cool. All right, let's jump in. I am so pleased to introduce the experts for tonight's incredible session. Virtua's OBGYN, Kristen McCullen, Virtua's gastroenterologist, Jaffe, and Virtua's primary care physician, Jaclyn Morales. So excited to get started with this. Dr. McCullen is a board-certified OBGYN. Her love for women's health began during her medical school clerkship. She has been practicing for 20 years and currently works at a Virtua's OBGYN Swedesboro and Hamilton locations. By the way, I have 3 friends that all had their babies at Virtua, and their babies are perfect and so smart. So clearly it's Virtua's OBGYN program. She loves spending time at the beach in Cape May with her 5-year-old daughter, Charlie, and her 2 dogs. Dr. Jaffe is a board-certified gastroenterologist serving patients at Virtua's gastroenterology program in Medford and Sewell locations. Her time in the Peace Corps, yes, the Peace Corps, amazing. She strengthened her desire to become a doctor. She has a particular interest in women's digestive health and has published numerous articles and presented at medical conferences nationwide. They all say it starts in the gut. That's where they all start to that. So we're going to get to that. Don't worry. She has three kids, twin daughters, and a son. In her spare time, she loves being active and traveling. Dr. Morales is a board-certified family physician born and raised in Camden County. She is currently the lead physician at Virtua Primary Care in Lindenwood and works additional hours offering urgent care telemed appointments. Dr. Morales has a passion for women's health, treating children ages 4 and up. She is married, lives in Washington Township, and recently had her first child. Congratulations. And she enjoys spending her free time with her family and her pets, and enjoys local breweries and trying new local restaurants. Yum. Welcome
Thank
to
you.
the panel. How are you guys this evening?
Wonderful.
Great, thank you.
Thanks, Nicole.
Oh,
awesome
course.
Intro.
Listen, nothing excites me more than smart, badass women and gorgeous. We're all gorgeous. Watching, we're all gorgeous. Make sure you tell yourself you're beautiful before you go to bed. All right. So we have a fun chat in store. As you know, today's topic is around doorknob questions, which are those questions that you're nervous to ask until the last moments of your doctor's appointment. Oh, the door before the door closes. Oh, that just clicked for me too. So we are proud to offer this session as a safe space for you to ask those burning questions without judgment. But remember that if nothing else comes tonight, please remember it's also important to be open and honest with your dialogue with your doctor. Because I think a lot of times people feel really comfortable in this space because they can remain anonymous, but like your health is literally the most important. They always say like, you're literally nothing without your health. So doctors have seen it all. They've heard it all. This is why they go to school for 27 years. So because they're ready to answer your questions. Okay. So we received a number of questions regarding the recommended frequency for various doctor's appointments. So we're like starting at the really infancy, right? So let's start there, Dr. Morales. How often should we seeing our primary care or family medicine doctors?
So this is a loaded question but just to keep it simple, it really depends on your age. So I always say age appropriate screening based on past medical history, based on family history, based on any habits that you have, bad or good. But, for the younger, healthier population, I'd say at least once a year to get it if they have no medical, assuming they have no medical history or family history, once a year to get a weight check, a BMI, a blood pressure screening. And then anybody with chronic medical conditions like high blood pressure or diabetes, it's usually once every 6 months, depending on how well controlled those are.
Because it is interesting when you have kids, right? They usually go like once or twice a year to the pediatrician until they're a teenager. And then all of a sudden it's like after college,
Drop off.
like a drop off. And I do think like with urgent care now, people are trying that, but there's something so wonderful to have an established connection with your doctor.
Right. That's why I say your planned visits with me are at least once every year. But remember, if anything comes up in the interim, I'm a my chart message away. Sometimes I take care of it without seeing you, and then sometimes I can take care of it and see you and prevent you having to go to urgent care.
And
You're right. That's the point of a family doctor.
and like a blood work panel, like would you consider that no matter how old you are to get that once a year?
Uh, it really depends. So yeah, so it's with young menstruating women, I usually get like a screening CBC on them. But or patients, it depends. So if they're on any medication or any supplements, I like to get a kidney and liver function. But not necessarily for every patient. No, not blood work every year.
I'm a hypothyroid girly, so I go every 6
That's what I was gonna say. Yeah.
Yeah, that's me.
Any chronic condition, 6 months. Yeah.
Yeah. And okay, so the ladies also want to know about OBGYN, midwife, and specifically when we stop. So like the general rule of thumb is to begin regular seeing your gynecologist when you become sexually active. So is it under 21? I'm assuming there's people that become sexually active, and girls are now having their periods 10 and 11. So can we talk just a little bit about like the age range for seeing a gynecologist?
Yeah. So usually 15 and younger, because I have friends and they'll call me and say, hey, my 10-year-old started her period and she's missing school because it's so heavy. I usually defer to like a pediatric gynecologist for those younger patients, but really 14 and above we see in the office. And especially if they're sexually active, I mean, that's absolutely grounds for coming here. You don't need a pap smear portion until you're 21. And that's where it gets a little confusing because a lot of people equate your pap smear as your GYN exam. And so they hear, oh, I don't need a pap smear, I'm 21, I don't have to go. A lot of times I'll encourage moms that I take care of to even bring their college age daughters before they go away to school, even if they're not sexually active, just to establish a connection. This way they're away at school, they're busy and they have an issue. They can always call, talk to me, things like that. Really from 21 to for pretty much forever, we expect to see you for a pelvic exam, get you set up for a mammogram, do a breast exam, pretty much every year. After 65 falls back into a little bit of a gray zone because most people are on Medicare and Medicare only covers every other year an annual exam. And I talked to exactly. And I talked to all my patients about that too, that if you're ever having an issue, you can come in and see me once a month. I don't want anybody to have to come to the gynecologist once a month, but I'm just putting it out there. You can come in as much as you want and that's covered. But the pure annual after 65 is usually every other year.
That's been a big topic. We've done a couple of these, and a lot of women think like, oh, after menopause, I don't have to go. And a lot of times, no, that's when some of the issues really start. And then let's be honest, like 65 is young now, right?
Like, same way.
We kind of joke around about it a little bit, but they say like the 55 and over communities have like outbreaks of STDs.
Oh, yeah.
Your people are still getting it on, which you should. We're all about feeling good here, but like you can't be not going to the doctor. You know what I mean? So
yep. Yeah, I tell women that all the time. My mom is in one of those 55 and over communities, and I'll go there and all the
my mom's one.
I can't wait to be 55. They have so much fun at that place. I love it. But they ask all the time, do I still have to come and see you? And I said, yeah. I said, like, even if you don't need the pap smear part anymore, we should still look at the skin on the outside and make sure it doesn't look like there's anything, to do your breast exam. There's a lot of parts of the exam that are still really important.
Yeah, no, it's really important. So while we're on the topic, we received some questions about how to prepare for your annual GYN visit. One of the most common concerns is regarding vaginal odor. And besides bathing, what can we do to ensure that it smells good down there? And obviously like douching has been a really hot topic, right? Where like it feels like back in the day, everybody was really pushing that. And now we kind of learn that that might not be the best thing for you. I have said this on other calls, is that my mom was always like psycho about, she would like, nothing goes in your area. She wouldn't let me do like bubble baths. I always had like plain Dove soap because the pediatrician was like, absolutely not. So it's like something's been ingrained in my head since I was little.
Well,
So I,
a very smart woman, because I'd be saying the same thing. The only thing you should be doing is washing the outside with Dove and nothing else. No perfumes, no scent. There's a hot move toward a new deodorant called Lume, Lume, that's out there. And that is actually endorsed by a gynecologist. A lot of people swear by it, but I always counsel patients, it's not meant to go in the vagina. That's designed more for women who feel like they have a vaginal odor that's more coming from like the groin area. And so that is safe for the outside, but you want to, not put that inside the vagina. And I tell this to women all the time, because sometimes they'll come in from the office and, oh my gosh, I'm so sorry I didn't have time to shower. I'm going to let everybody in a big secret. We don't care. It doesn't matter. We don't notice. I don't care if your pubic hair is long or short or shaved or bald. None of us care. We have seen it all. I hate when people feel like too self-conscious to come in. We want you to feel comfortable any way that you are.
Yeah, that's so, so, so important, because a lot of women are just like, oh, I feel weird. And it's like,
we don't care. We really don't. I swear.
What would you say that would be considered problematic? Like if somebody has an odor that they think, oh, this isn't good, that's when you could come in and just ask.
Absolutely. Anytime you feel like there's an odor that is unnatural for what you normally smell like, I always tell people to come in. There's so many things that can throw off our pH, make some of the natural bacteria overgrow, and it's infectious. You need to be treated. And it's not an STD, but as that overgrows, a lot of women have discharge, irritation, and odor. It makes them feel uncomfortable with their partners. So I tell them to always come in and get screened. Now, some women will come in and everything will be negative. And sometimes we'll recommend like a vaginal probiotic for a little bit better pH balance. There's something called boric acid, which sounds horrific, but I promise it's not, that can sometimes balance an unnatural pH. So there's some more natural things we can try too.
Yeah. Awesome. Again, another really important example of like talking to your doctor and just like being aware of your body. All right. So one of our most popular questions was related to urinary incontinence, AKA bladder leakage. Can you give us a rundown? Is it normal? Is it normal as we age? What may have caused it? It's surprising because we know that nearly 50% of adult women experience incontinence in some point of their lives, but a lot of people are embarrassed by it. So it's definitely so many questions poured in about that.
I think it's so important that so many younger women are now talking about it, because I'll again have older patients that have suffered their entire lives and never wanted to talk about it. They would put on a pad that was stinky all day and be too embarrassed to talk to their gynecologist. And really, you come in to see us and we have to figure out, is it something structural, which is like stress incontinence? And that's the leaking you get when you cough or you sneeze or you laugh or you jump on a trampoline with your kid and your whole bladder empties down your legs. Or is it urge incontinence, where like your bladder just contracts too fast and you don't have time to get to the bathroom? And the reason we have to figure out what it is there's very different treatments. The urge incontinence can be as simple as taking a pill every day and you'll never leak again. And then the stress incontinence, I send people to pelvic physical therapy, which is not really invasive. I teach them how to do Kegel exercises the right way and not the way Cosmopolitan magazine makes it sound. And then a lot of times I refer to my urogynecologist buddies, and they have very minor surgical procedures that are not bad recoveries to kind of support the urethra or the opening to the bladder so that you don't get that leakage with activities. But it is something that you should definitely mention to your provider and not suffer from.
Yeah. And the fact that it is so common.
Yeah.
Another thing about Virtua that's so wonderful is there's so many specialists. Like you just there's a urinary gynecologist.
Yep.
You mentioned Dr. Morales, you mentioned a pediatric gynecologist, right? Like a lot of times people don't think that exists, and it does. And so all these questions can be answered in that. So while we're on the subject, another popular topic was fecal incontinence, which I don't think a lot of people talk about at all. Dr. Jaffe, what causes that? And are some options to resolve it? And maybe just describe what that is, to be honest.
So, Nicole, thanks for that. Fecal incontinence actually, quite common. 50% of the population, majority women, tend to suffer from it, but we also have men. It ranges all ages, mostly in older women, but we do see it in younger women as well. A lot of issues with regards to obstetric injury and trauma can affect the pelvic floor integrity. You can get neurologic issues such as diabetes, spinal cord trauma. So there's a whole range, but you do see a lot of women suffering from this. more than women, more than men in our society. But a lot of them are,
What else
go
do
ahead.
women suffer from, right?
Yeah, but they, I think a lot of them are suffering in silence. They're afraid to come and speak to, they're afraid to talk about it. I think it's embarrassing for them. It's something that some are ashamed of. So, but it's definitely something, if you are suffering from it, it's not normal part of aging. If you do have issues with it, I would definitely seek out your physician, your primary care, your GI doctor. It's something that definitely we can kind of figure out. It can be related to diarrhea. You can have it from sometimes your gallbladder being removed and you have poor pelvic floor strength, and that can cause urgency and incontinence. So, but there's various reasons why you would be suffering from it, but it's not something that you should live with in silence. So, and
another really great example is that there could be different reasons why you're suffering from it and different specialists that could help you.
absolutely.
You know what I mean? And but that's something that, to be honest, like when I was reading the talking points, I was like, oh wait, like of course that's a thing. Like it didn't even dawn on me. But you're right, because so many people, especially women, probably just don't talk about it or are afraid to talk about it.
Yeah, I think it's an embarrassing thing to discuss. I think some women are afraid to discuss it even with their friends and family. I think it's isolating sometimes because of the issue. So instead of discussing it or seeking help, a lot of women will end up staying home, avoiding social gatherings, afraid to fly on a plane, travel, all these things. And I think it's something super important that we provide awareness for, because if you are experiencing these symptoms, especially I think in the primary care setting, or even, any type of first line practitioner, some of the patients will kind of indicate they're having bowel problems or it's diarrhea, but they're really trying to express to you there's something else going on. So it's important for us as practitioners to really be keen on identifying those patients, and they're trying to say something to us, and kind of delve into those symptoms, because we can really help them. There's basic conservative measures where we can help this issue, and then there's more advanced where it can be curative. I've seen some really good outcomes for patients who have been suffering for years, and really afraid to discuss it with anybody.
So two treatment plans that have mentioned here is the peripheral nerve evaluation, which I'm assuming, can you just expand a little upon that? And then is it the interstim device implant? Am I saying that right?
So that would be more
Great anatomy that I watch.
So the peripheral nerve evaluation, the interstim, would be more of an advanced step. First, we tried dietary modifications. We kind of ascertain, what are you eating that might be exacerbating this? And then you take a really good history and physical also. So it could be anatomical. Like I said, you can have obstetric injury. You can have, your gallbladder removed, and you're having issues with urgency and diarrhea. So a lot of these things we could initially do dietary modifications. We can do biofeedback, as Kristen was saying, with regards to urinary, because interestingly, FI, so fecal incontinence and urinary incontinence, it's the same nerve, it's the S3. So indirectly, when we treat, it kind of affects the same nerve pathway. But for patients who are kind of at wit's end, they've done all of the dietary modifications, they've done the biofeedback, they've done the Kegels, and they're kind of always looking for where the next bathroom is, always on alert, afraid to leave the house. They would be a good candidate potentially for the peripheral nerve evaluation. And that is a very simple, non-surgical testing procedure. I kind of describe it as acupuncture. You have these thin electrodes. We have the patient come, and they lie on their stomach, and it's right above their buttock, and it's the area that actually innervates and gives kind of strength to the urinary and the fecal muscles. So we attach these thin electrodes to that area, and then they go home for a week, and then they assess if they have continence. So that's the testing period. It's not surgical. It's most likely kind of like a superficial acupuncture type procedure. And you get a little kind of stick, and then you go home for a week, and you see if you have bowel control. So it can innervate, modulate that nerve. They may have urinary and fecal continence with that. So they come back in a week to the office, and if it works, then I refer them to our colorectal guys, and they can do a tiny implantation in their buttock fat, which innervates that area, and it can treat both urinary and fecal incontinence. So that's
so cool.
It's great. It's quite, when it works, it really works. And, you know, I have patients who literally, you know, I had one patient who was traveling all down south, saw all of her friends. She's like, I went to church group. I went to, you know, I saw all my friends, and she was just so happy. She wasn't afraid, you know, to leave the house. And I think it's so important because you're preventing anxiety, depression. You know, I think longevity is, you know, the big thing about longevity in our society is socializing, being with people, engaging, right? So if you're afraid, then that's an aspect that, you know, can be negative effect of that. So this is kind of a way where we can get them back out into the world, you know, with people, like engaging in life.
There's probably people that didn't even think that this was a possibility. So once again, talking to your doctor, you know, not being afraid to say what's actually going on. All right. So we also have some questions regarding various dietary vitamins and supplements. So is there a specific product or regimen that you recommend as we age? And Dr. Morales took a break really quick. Oh, she's back. She's back.
Oh, just checking on the kids. They were too quiet.
Yeah, this is why this is so great, because it's like you moms are superheroes. So ensure that like our kids are not didn't leave the house.
That's right.
Yeah.
So I heard the question. So this is a common question. So there is no official recommendation for a multivitamin for anybody, any age. I do say I see patients ages 4 and up. So even in pediatrics, there's no official recommendation according to the American Academy of Pediatrics for multivitamins. However, I do recommend them for kids or adults, which adults are as well, but picky eaters. Because, you know, obviously we expect everybody to get their nutrients from their food sources. But if you have somebody who's, you know, I have a guy who only eats pizza and macaroni and cheese and chicken nuggets still. So, you know, he's on a multivitamin, because if you have such a, you know, particular diet where you're restricting so many foods, then yes, a multivitamin. And yes, so women 50 and up, obviously the closer you get to menopause, actually, I really try to encourage everybody to at least take a vitamin D supplement. The official recommendation for adults or kids ages 12 and up is 800 international units a day. But it's really hard to find 800 in a multivitamin. Usually most multivitamins, unless it says women's 50 and up, is only about 400 international units. And it's difficult to find 800 by itself. So I typically have people pick up at least 1,000. And if they're also on a multivitamin, 1,000 in addition to the 400 IU in your multivitamin is fine. Even up to 5,000 a day is fine. However, I don't recommend that high, but you know, I still have people who are supplementing with 1,000, and then I'll obtain a vitamin D because they asked me to. Not that that's standard, and it's only 28. So I'll say, okay, bump it to 2,000 international units. So at least vitamin D, because, you know, vitamin D has been linked to, or chronic vitamin D deficiency has been linked to fatigue. And vitamin D in general improves even things like glycemic index. So even improves A1C in diabetics. So then obviously the most important is preventing osteoporosis as early as possible. So I say, you know, especially nobody's drinking a glass of milk a day anymore. Milk has a lot of sugar, milk has a lot of fat. So if you don't have dairy, we have a lot of people who are not eating dairy anymore. So you don't have dairy in your diet or don't have milk in your diet. Everybody should be taking a vitamin D supplement. And yes, especially women who are approaching menopause. Closer you get to menopause, you can incorporate calcium in there as well. Once you have osteopenia, osteoporosis, where the official recommendation is 1,200 milligrams of calcium, whereas a typical tab is about 600 milligrams. And no, everybody doesn't need calcium. So I do watch if I recommend calcium, I do watch the calcium on the labs, because you have some women who they're already borderline high with calcium. So I'll say 600. And, if they're on 1200, we scale back. So that was a long answer, but
Like if you're all over TikTok or Instagram, magnesium is like the hot topic, and everybody's talking about magnesium this, magnesium spray, magnesium before bed, magnesium in water. What's your take on magnesium?
So magnesium, so hypomagnesemia, like low magnesium levels, can be a cause for hypocalcemia. So then you would need to supplement. Um, Most people do not have to supplement magnesium. However, in any patient with any cardiac history, we want the magnesium to be 2. That's usually drawn by the cardiologist. That's their standard set of labs. But yes, magnesium supplementation can help with headaches. It can help improve sleep. However, just my first recommendation for sleep, other than discussing sleep hygiene, is melatonin. But to take it earlier rather than later. Bedtime is too late. But I don't recommend magnesium supplementation, but I do have a lot of questions about it. It really depends on the patient.
Okay, so let's transition to fiber. That's another really big hot topic right now. And how many times a day should we be going, number 2? And should we take fiber supplements? And then I have my own questions about other supplements that aren't on here, but I'm going to ask them anyway after we're done.
So
I'll
I
let
think
Dr. Jaffe answer that.
I'm the fiber lady. Well, I think on average, most Americans that have, in general are only taking in about 10 to 15 grams per day. It's too low. So, I think with our Western society, a lot of the processed foods, we're very low on our fiber. We should be taking up to, especially for, up to 50, at least 25 grams a day. And to give some perspective to that, for example, obviously fruits, vegetables, legumes, beans. The 2 gummy fibers are about 3 grams. If you do like a kiwi with the skin on it, it's about 3.5 grams. So you really have to, improve your dietary intake of greens, fruits, and vegetables with the skin, all of these things to get to that 25-gram level. So cut out a lot of the processed foods, drink enough water, and that really actually helps your colon health because it brings through a lot of that stool if there's not stasis, and keeps motility, and for, patients even with diarrhea and the fecal incontinence, I tend to have them increase their fiber because that helps them bulk up the stool and solidify the stool so you get formed stool. So but with regards to how often should we be going to the bathroom, that's varied, I think, for each individual. A lot of people have different norms, the way they are, kind of wired. So some people have to go every day or they don't feel well. They get headache, they get fatigue, they get nauseous. But some people can go a couple of days, and that's normal. If you feel well and that's your norm, then that's okay, as long as you're getting in enough fiber, exercise, lots of water. If you start to not feel well, if you're going too much or going twice a day or 3 times a day is too much for you, then you want to seek out and, discuss this with your GI doctor. And same way if you don't, go enough and you see a big change in the caliber of your stools, it's getting too thin or it's too hard or pebble-like. We even have like a Bristol stool scale where we can assess that and help figure out how healthy the colon is. So it's different for everyone, but in general, I would say as Americans, we need more fiber. And as we get older, it's really important because the colon itself, just like we get gray hair, we get arthritic, our bones, our joints get old, our colon gets a little sluggish and old. So we need a little help from that increased fiber, a lot more exercise and water.
So what about if people are having a hard time going to the bathroom?
Mm-hmm.
Long, they're pushing. Could it cause hemorrhoids?
Oh,
And
yeah.
yeah.
Yeah,
And so
absolutely.
what can help if people are having a hard time actually getting their stool out? Is what would you recommend to try at home? Is that more fiber? Is that more water? Is it trying your diet, or do you call the doctor right away?
So if you're starting to have some issues or difficulty having rectal fullness, you're having some, a little bit of bleeding on the tissue paper, you're concerned about hemorrhoids and, the biggest thing is obviously, yes, increase your fiber if you can't tolerate that. You know, even diarrhea, chronic diarrhea can cause hemorrhoidal issues. But if you're worried about hemorrhoids becoming an issue, definitely, you know, seek out your GI doctor, because we can kind of figure out what grade they are, you know, how they're affecting you. Also, some of the symptoms that you may be attributing to having hemorrhoids, like bleeding or change in bowel habit, you know, feeling kind of fullness or pain, there might not be hemorrhoids itself. So you definitely want to be evaluated for obviously the other, you know, bigger things that we want to rule out, you know. So
yeah, I always thought that hemorrhoids were caused by like childbirth, but there's a lot of different reasons that could cause hemorrhoids.
yeah, definitely being pregnant, you know, because you're carrying that baby, pushing down. You have all these hormones that relax your smooth muscle. So that definitely exacerbates your hemorrhoids. Obesity, but definitely prolong, you know, our Western way of going to the bathroom. We have this big toilet with, you know, nothing in the middle. So all that pressure is going towards our hemorrhoidal tissue. There are cushions there and they swell up. They fill up with fluid. They're vascular. So when you have a lot of pressure, when you're escaping your family and sitting in that toilet and taking your time on your phone, that can exacerbate hemorrhoids. So, but other things like intra-abdominal pressure, like coughing too much if you're sick, or even lifting heavy weights. I see a lot of young men and men in general who lift heavy things for work or are big, you know, weightlifters, and they come in and they go, "Doc, oh my God, something's wrong down there." So that can, you know, I have to explain to them that can exacerbate it. So they really have to kind of, the first line of treatment, increase your fiber, drink lots of water, decrease your intra-abdominal pressure, you know, activities, and then you can soak them in sitz baths because it can kind of shrink that tissue. Witch hazel has an element in it that kind of brings out that water from the hemorrhoidal tissue, so it kind of decreases that swelling. So a lot of TLC, but if it keeps happening over and over again and you really can't get a hold, you know, handle on it for at least a week or two, definitely see, you know, your GI doctor, your colorectal surgeon, so we can actually get to the bottom of why they're still coming back over and over again, because it's something in your behavior that we can tease out, your diet, or something else is going on internally. So important things to remember.
What about the squatty potty? Does that work?
Well, so the way it does to some degree, there's this thing where you put your legs on kind of like a little stool, and our colon has this S shape. It's called the sigmoid. So it's kind of like a kink. So all it does is changes kind of our anatomy. When you lift the legs up, it goes from an S shape, the kink, to a straight line. So the stool goes straight beeline instead of going right angle. So that's what, you know, that's all about. So it does help. And, you know, I have it in every bathroom in our house.
The gut doctor says the squatty. All right, two questions about supplements that I'm really curious about, and then we're going to go to the Q&A. But one is, I mean, as you can see, I spend a lot of time on TikTok. I love information. I love knowledge. So the one thing is a lot of women are suffering from UTIs, right? And you know, they take about taking cranberry supplements and drinking the just cranberry juice. And you know, I think it's just to talk about UTIs just in general, because it, at least in my age group, or even like women in like their 20s, 30s, even early 40s, where whether you're having a lot of sex or it's the summer, you're sitting in a bathing suit, and you know, talk a little bit about supplements and UTIs, and is there a way you can cure it by yourself? Or I had a friend that was getting constant UTIs and she ended up doing pelvic floor therapy, and that helped her tremendously.
Yeah. So there's a lot of causes, you know, with younger women, like, you know, our daughters will get them just from like hygiene, you know, as we get older and we go through menopause and the vaginal tissue is thinner, our urethra is a little bit more open, and it basically gives like a gateway into the bladder. And that's why a lot of older women can tend to have a little bit more UTIs. The most common cause is what you said, it's sex, you know, honeymoon cystitis, where you're having so much sex that and you're not maybe going to the bathroom afterwards and you wind up with a rip-roaring UTI. Unfortunately, most of the time, a true UTI is going to require an antibiotic to be treated. So you'll need to see either your primary or your gynecologist, get a urine culture to figure out exactly what's going on. Preventatively, there are lots of supplements out there. I'm a TikToker myself. I totally watch all those things. And, you know, there's a supplement out there by a company called Euro right now. It's, that is really big on like vaginal health and UTI health. And a lot of them focus on the cranberry supplement. Yeah. My biggest source of education, my biggest part of education is that like it's not your ocean spray cranberry you get from the Wawa cooler. It's a very high concentrated cran, and it's basically to change the pH of your urine to not allow it to be an open environment for bacteria to grow. And they have been shown to work. thing that it stinks is if you're not getting frequent UTIs, now you're taking a supplement almost every day to try and prevent it. So you have to kind of balance that. For my patients that come in a lot with UTIs related to intercourse, one thing I offer them is sometimes to give them an antibiotic to take with sex. And they look at me kind of like I'm crazy. And I warn them it's not an aphrodisiac or anything, but you know, you take it either before or after sex, and it doesn't allow those bacteria to set up shop in your bladder. And so it can be more preventative. You know, that's for my patients more that have more than like 4 or 5 in a year related to sex. That's a lot. You know, it's a lot of suffering to go through that.
Yeah. Okay, really quick about supplements, probiotics, prebiotics. Another really hot topic. You go to Whole Foods, you could spend $60. We're talking about antibiotics, and then we're talking about bacteria. Can't do probiotics work? Should we be taking probiotics? What are your thoughts on that?
I think, oh yeah,
sorry,
go ahead.
I'll go after
Yeah, you go ahead.
All right, so for vaginal health, there's a million out there now. I mean, it's unreal. There used to only be a couple, and now they're everywhere. There are some that have been studied to have shown, like, especially patients that suffer from recurrent yeast infections, bacterial vaginosis, they do work. So the ones for vaginal health, you know, again, talk to your gynecologist about what ones they prefer, because some are definitely better than others. But there are things that can help those people that get recurrent infections.
And how about gut, for probiotics for your gut?
Yeah, I tend to recommend it when patients are on antibiotics for whatever reason. I think the evidence is unclear out there that, you know, for its efficacy in general. So I don't just put everyone on it, but the placebo effect is quite, you know, wonderful, because patients say, oh, I went on a probiotic and my, you know, constipation got better. I don't take them off. I'm like, okay, go ahead. But I think there is evidence for ulcerative colitis with the probiotic, especially VSL3. So I think jury is still out. I think if you overdo it, I had a patient who overdid it and had so much gas and bloating, I had to really back her off of it, because she had several rounds of C. diff and she was just petrified she would get it again, and was taking like enormous amounts of probiotic. And I really had to say too much. So everything, you know, modified and imbalanced. But I think from a GI standpoint, there's not a whole lot of evidence except the ones I kind of mentioned. So, but if it's not hurting, you know, it can't hurt, but it's not going to cure, you know, disease. So it's okay if they take, you know, while they're on antibiotics, and if it's helping somewhat of their regularity. So
yeah. You just mentioned C. diff, and we have a question. And I saw a TikTok the other day that said there was a gastroenterologist who was in an airport bathroom and he smelled something weird, and said that the guy, he could smell it. Is that true?
Yeah, there is a distinct smell. It's quite noxious. It's kind of stinky. So definitely, yeah. But I think, but you have to remember.
He was like, if
you
like,
yes,
bathroom, you have C. diff. And I had to Google. I'm like, what? C. diff? And
but but C. diff, the big thing to take home about C. diff is, you know, if you have good bowel flora, meaning, you know, you're not knocking out all the bad bacteria with antibiotics, you are not going to automatically get C. diff. So you have, you know, an army of defense. So a lot of patients are like, oh, should I, you know, clean my entire house with like, you know, Clorox, and you know, do I have to gown up and glove up? I can't hug my, you know, my grandma or my family member. It's not, in general, that's not true. You have to literally knock out the good flora to be susceptible to the C. diff infection. So chemotherapy, if you're immunosuppressed, all these things, you know, obviously you can have the community acquired, but in general, if you're healthy and you're not on antibiotics, it's kind of hard to get C. diff, you know, in general.
Another good example of why it's important to talk to your doctors and not just like go off what you see on the internet, because people see antibiotics, bad, I need probiotics. And it's like, no, like there's a reason that there are experts who deal with this on the regular, because you need the balance to make everything in your body work. It's a machine that's working, you know? And I think that some people are like, oh, it's easier just to Google than talk to my doctor. And we're here to say, no, please call your doctor before you Google. All right, so let's get into the questions, because I see a lot of questions pouring in. I'm going to go to the very first one. A lot of information. This may be an answer of, please, you know, talk to your doctor, but I'm going to read it anyway. Had a pancreatic gastric attack on a cruise, and then had all pancreatic enzymes, stool for C. diff, toxins, were all negative, was on Creon for a month. Second opinion told me to get off of it, and I don't have pancreatitis. Please advise. That seems like something out of the TV show House.
So yeah, it sounds like some type of infectious process while on the cruise. The diarrhea, was ruled out for obvious causes, and the Creon is probably not a good idea because she does, you don't have pancreatic insufficiency, and that was ruled out by the stool study. So most likely you have either post-infectious IBS, so you're having some bowel issues from that, or you just have to kind of get over the illness. The bowel flora needs to kind of regulate again, and sometimes it takes a while. You can have bloating, you can have irregular, bowel movements, just not feeling quite right. So, but definitely, I would not recommend the Creon because you don't have pancreatic insufficiency. I don't know if that was the question that was being asked, but give it time.
You can just give it time. I'm dealing with pain using CBD capsules. Would using THC help me? And could I still function normally?
I mean, that one's for me. I don't know. Yeah, so I do have some patients. It really depends on the patient, the age, the medical history. How are you getting your THC? Where are you getting it from? What form of THC? But typically the rubs and the ointments, yeah, there's no problem with that for rubbing that on the joint. For aches and pains. But it depends on where are you in pain? Why are you in pain? How old are you? What is your medical history?
Getting to the root of where the pain's coming from, not just
right.
Yeah.
Right. I always call those other things a band-aid, right?
Yeah.
So if you have really bad osteoarthritis and we're bone on the knee, and we're talking about quality of life, and you're still young enough to get a brand new knee, but not too young that you'll need 2 knees in your lifetime, then, getting some x-rays, seeing an orthopedist, talking about even steroid injections, things like that.
I feel like I'm carrying a golf ball in my vagina. I'm not constipated. What's causing that?
I think that's mine. So I really think like if you have something like that, you should absolutely see your gynecologist. There's a lot of things, women sometimes come in, they'll say, I put my finger in my vagina and I feel something. And a lot of times they're feeling their own cervix. As we get older, people that have had babies, we get a little prolapse of our uterus. And sometimes it can be our bladder prolapsing. It can be our rectum prolapsing. It can be our uterus and cervix coming down. So if you're feeling something like that, you definitely want to get an exam. The other thing is we have a ton of glands in our vagina that produce secretions, and one of them gets blocked and you get like a golf ball size lump in there. And sometimes it can go away on its own. Sometimes you need antibiotics. In really extreme cases, you need it surgically excised or drained. So if you're feeling something there, especially if it's a new onset, you definitely want to see your doc.
Yeah. Is it normal to bleed for a month when going through menopause?
Yes, the joys of perimenopause. So it's not the menopause. So menopause is when you go a full year with no periods. If you go 365 days to the year with no periods and then you have bleeding, you need to see your gynecologist for an evaluation. Unfortunately, the 10 to 15-year road up to menopause is perimenopause, and that is where our cycles can be dramatically altered. And basically what's happening is our estrogen and our progesterone isn't cycling perfectly anymore. So the lining of the uterus gets thick and then it sheds, either over a very long period. I'll have women call me and say, I can't even get out of the car without it going onto my socks. And, again, it's important to see your doc so you make sure that there isn't any structural abnormality that's contributing to that. And then there's a lot of different options to help control heavy bleeding during those periods. But I hate to say it's normal because I feel like that's like being dismissive, like, oh, it's normal. Like it's normal to happen, but you need to be evaluated to see what we can do to help.
Yeah. You said that story about a woman who like drips through the socks, and it just like makes me so crazy how like we were conditioned to think like, oh, you have your period, you're in a bad mood. Yeah, Chad, I have blood gushing from my vagina and have to cotton up there to stop it.
Yep.
Sorry, Jeff. Like it's so crazy that that's what they condition women to do. I was like, oh my God. Now I like walk down the hall holding my tampon. You know what I mean? Like, modern woman, here I come. Okay. What can women do that have trouble reaching an orgasm after 60? Can using adult toys have an impact on this problem?
Yes. I tell everybody, especially women that are having a hard time with orgasms, go get some good toys. Because sometimes, a lot of women can't achieve orgasm from normal intercourse. A lot of times the vibrators, there's different creams you can use to increase your arousal during that time. You absolutely need to get to know your body. Don't be afraid of it. And again, I tell women all the time, like, talk to me about this stuff. I'll bring out a catalog and tell you what I recommend to help you. It's something that you don't have to be ashamed of it.
And even if you're under 60 and you can't orgasm, you need to definitely still talk about it, because
Absolutely.
there's so many women that aren't being pleasured, and it's crazy. Again, people get away, women have gotten, or I should say men have gotten away with it for so long, and women are now like, no, I want to feel good.
I see women that have been married for 40 years and have never had an orgasm. And I'm like, they're in a very loving relationship. It's like, well, talk to your partner about things that are going to feel good. It's very important to open up that communication.
Absolutely. At what point should you ask your doctor about fixing external hemorrhoids?
So I think that's me. Hemorrhoids in general are somewhat normal. So if you have the grade 1, they're not sticking out. They're actually important to help you have continence. But if they start to bother you, fullness, pain, bleeding, itching, mucus secretion, they're irritating you, definitely come and see, me, the GI doctor, colorectal guys, because we have simple ways we can treat them in the office. We'll give you kind of tips. Obviously, increase your dietary fiber, hydration, don't strain, don't sit on the toilet forever. But we have a simple way where we can band them. They're rubber band ligation. It's right in the office. There's no sedation. We talk about how bad they are, what your symptoms are. Then you just lie there on your left side, and we can actually, it's almost as thin as my finger, and my finger is very thin. And we use a little loop, insert the plunger, and we rubber band the tissue, which is vascular, and it chokes off the blood supply. So then it's kind of like a little facelift. It tightens up that tissue because it falls off, and you get a flattening of that bulging hemorrhoid. So the internal ones, you don't have pain. So that's easily done in the office. A lot of the external hemorrhoids you do feel, and they're not reducible. So that's more of a difficult treatment. But if you have ones that kind of pop out and you push them back in, or they go in by themselves, you're a very good candidate for ligation. And it's a very easy, when you come to the office, it takes about 10 minutes, and then you leave. You can go about your work. You can go back, pick up the kids. You can go work out. You can take a swim. You can go grocery shopping, whatever you need to do. There's no downtime. And that's the beauty of it. It's very incremental. So you're taking a little bit of tissue at a time, but it does work because it's scarred down on the inside, and you do it little by little. But, it's not a surgery. There's no sedation, so you don't lose any downtime. You can literally go back I have a lot of patients who come in and then go back to work the next, that day. So that's an option, definitely.
Wow. Awesome.
Yeah, that's quite nice.
Yeah. Again, quick in and out. It's like plastic surgery, but for your butt.
Yeah, that's what I say. It's like saggy tissue. So you're getting a little facelift to your hemorrhoidal tissue. But it's great.
Due to moving, I had to change my primary. The wait was so long, I'd have a nurse practitioner. I do like her, but should I switch to a doctor?
Yeah, good.
So I can answer. Yeah. So I have nurse practitioners. I have a nurse practitioner in my office. So I will point out that, not that there's anything wrong with seeing a nurse practitioner, and rest assured they're being supervised by a physician in the office. So not directly that they're overseeing every patient encounter or things like that, but we will randomly review charts. My nurse practitioner, I love him to death. Any time I'm with the patient and he has something that he wants me to see, or a patient wants my opinion, he'll knock on the door and interrupt, and he feels safe. So yeah, there's no problem with that. We have run into the problem where particular insurance companies won't reimburse for the visit for a nurse practitioner. They'll actually bill it as a specialty, and then I've had to write a referral for a nurse practitioner. So we've run into that issue. So I just encourage you to one, read reviews online. They are honest, regarding the providers, and regardless of their credentials. And number two, just making sure that your insurance company will reimburse for those visits.
Okay. What if you have osteoporosis and kidney stones? I don't know. I don't know. Does they go? I don't know what that means. Do they go hand in hand, or is
I
that
think
a?
what it's asking is that, what's the
Yeah.
treatment going to be? Because when women have osteopenia or osteoporosis, that's where Dr. Morales was talking about vitamin D and calcium supplementation.
Oh,
And
got
because
it.
kidney stones can kind of be precipitated by the calcium, you should be
Calcium.
taking extra calcium.
Oh,
I
okay.
don't know how Dr. Morales does it, but for a lot of those patients, especially once they reach osteoporosis, I often will refer to rheumatology. That's a specialist that does a lot of the prescription medications for osteoporosis. And there's oral options, there's infusions, there's injections. There's a lot of other options where you can kind of steer clear from the calcium, especially if you reach that level where your fracture risk is high.
Good to know.
Mhm.
Women seem to have a higher rate of dementia than men. Any idea as to why that's happening? I saw that some are linking to removal of the ovaries.
So that goes along with the menopause. So we all lots of us in the office are perimenopausal. We joke about our brain fog, that we walk into a room and forget what we were doing in the first place. And not to joke lightly about dementia by any means, but that's where that's kind of going. So the removal of the ovaries, you lose your natural source of estrogen and progesterone, and can that lead to earlier onset of dementia in women? The studies are inconclusive, and it hasn't unfortunately been proven that by doing hormone replacement, you can slow that process or reverse it.
So what happens to all the receptors in our brains, the estrogen receptors, post menopause?
They don't
Do
work as
they,
well. Yeah, they think that's where the link is.
but they haven't, studied it quite
Nah,
yet, right? Yeah.
nah. It's like they've tried the different studies to see if there was any difference. But, I tell a lot of my patients that hormone replacement has really gotten like kind of a bad rap. There was a study done in the late 90s that basically made every gynecologist afraid to prescribe them. Made it seem like we were giving everybody, breast cancer, ovarian cancer, uterine cancer. And really, the newer studies have shown that we've done a huge disservice to women. The number one cause of women's death is coronary artery disease. What causes that? Lack of hormones. So hormone replacement is safe. You just want to talk to your provider about which forms and combinations are best for you.
And Virtua has their own hormone replacement practice, exuberant, right? Which is like so awesome. And I know some women, I had a coworker who said it changed her life. Like she thought she didn't know what was wrong with her. And it was like she needed hormone replacement therapy. Speaking of that, let's talk about low libido. I'm 49. Are there any over the counter supplements to help with that? I'm really struggling.
So again, low sex drive in women is something I talk about all day. And I wish I could, take care of men and prescribe any number of erectile dysfunction drugs that are available. And there's no little blue pill quite ready for us. They're close, but it's not quite there.
Go
If you
figure,
look,
another thing for men.
yeah, and we're wired differently. Men look at a picture of a naked woman and they have an erection, and women's sex drive does not function the same way. The only natural supplement that's really been proven to help is something called maca root. It's available on Amazon. It's something that you have to take daily. I don't know if it's a placebo effect. Some women will swear by it. Other women will say, great, I used it for 3 months and really didn't notice a difference. There are some newer prescription medications that are just coming out, but they have to be given to the right patient. There's some dangerous side effects, especially if there's like a pre-existing condition. But the pharmaceutical industry is trying. They're just not there yet.
Yeah.
Yeah, and just to piggyback on that, I'm curious if this patient, is on any SSRIs or SNRIs, because those particular medications can cause low libido. And just to throw it out there, the FDA did approve a medication to add on to that, and that's bupropion for that reason. And I see that a lot in primary care. And I actually counsel patients before I start an antidepressant that that's a possibility. And I don't add Wellbutrin right away, but I say, come see me if that happens.
Yeah.
Kristen, what are your thoughts about testosterone for low libido in women? Because, we have testosterone in our bodies, and I'm sure that affects our sex drive dramatically.
Yeah, I have women that come in and some do testosterone injections, which is like an oil based, and they do that once every 3 months and they will swear by it. Again, there's some side effects. Some women will notice more hair growth. The clitoris can get a little bit larger and more sensitive. My partner and I, she's done so much research on it. She's awesome. She started looking at like compounding testosterone, which is like a cream you apply. And you apply a little pump of this cream, and we tell people to apply it kind of like the vulvar region because it can make hair growth. So, I wouldn't apply it to your wrist and have like a patch of hair growing out there. But you apply it down some place where a lot of women shave, and it has been proven to help with that. So if,
Oh,
I offer
interesting.
that to women that are interested in hormones for, that, if the natural stuff doesn't work and they're interested in something prescription, yeah, it's definitely something that we can talk about.
I'm bringing up TikTok again just because, like, why not? But it's like book talk is all the craze right now, where like all these women over the age of like 30 are all like, remember like our moms used to like go to the grocery store and read like the Fabio books in the grocery store? Well, now there's like this whole section of books called like cliterature. And so many women are saying that it has helped their sex drive because like they didn't know like what aroused them when they were like 20 is different than 50. So they're reading all these like sexy books about a billionaire, falls in love with a secretary, and it's like giving them a new kind of like, getting them excited. And there's like so I'm like, that makes sense. Like when it started to come across my feed, I was like, oh yeah, I'm like, romance books has always been a thing, but like it's always been like taboo for women to enjoy that. But I think that
I
it's
tell women all the time that there is an app you can download on your phone. It's called the Rosie app, ROSY. And it's got a lot of information about different like gynecologic health and everything, but they have a little part of the app that's all erotica. And it's little short stories. And it can be a 3-minute story, a 5-minute story, a 10-minute story. And a lot of OBGYN like moms that I'm friends with, they, everybody recommends it to their patients. And it's nice because you're not reading a whole novel, and it really has been shown to work. So
Yeah.
it's the TikTok
The
strikes
cliff
again,
notes.
accurate.
The cliff notes of porn.
The
Of
cliff
women's
notes are
porn.
that's exactly what it is.
Or you can
There's
call
all
it
the studies that men are visual. They like to look at pictures. Like women, we don't work that way. So for us to read and kind of imagine the scenario,
Yeah.
it works.
Can you call it you could call it the clit notes. All right. This is a good one though, that I tried taking fiber gummies, but found them, I got very bloated. And then I resolved as soon as I stopped taking them, is there any supplement that you can take that does not cause the bloating?
Yeah, so it sounds like with the fiber, you're getting a little bit too much bulk. So that's creating the bloating aspect. You probably need a little bit more of maybe towards a laxative to exit the stool a little faster. The bulk of the fiber is kind of staying in your system and creating all that excess bloat. So sometimes that happens, and it might not be the best option for you. Just get it through your diet. And maybe take, if you want to eliminate a little better, a little bit of Miralax might help. So, sometimes fiber supplements are not good for everybody, are not as effective for everyone because of that side effect.
All right. I can't believe that it's almost 8 o'clock. So we're going to do one last question before we close out. Time flies when you're having fun and you're learning. I take Prolia 2 times yearly and take a vitamin D supplement, but do not take calcium pills because I am afraid that they have caused kidney stones, which resulted in 2 ER visits. Is diet the only way to increase calcium intake? That was a lot.
Yes, you could get it through your diet, but I just get your calcium levels checked by your doctor. So that's easy to do. We have the capability of getting that on the blood work. That's it's in most doctors' standard blood work. So we can see if you're on the high end of normal, the low end of normal, or right in the middle, and then obviously we can determine that you're getting enough in your diet.
And really quick, one more. Should I see an endocrinologist or rheumatologist for osteoporosis?
I think Dr. McCullen answered that. I do treat osteoporosis in my practice, but it really depends on the patient. So like Dr. McCullen said, any patient that is a little bit more complicated osteoporosis caused by chemo or radiation, or that they have chronic kidney disease or recurrent stones, or they've been intolerant to our first line, which is the bisphosphonates, or a history of any osteonecrosis of the jaw or dental issues or bad reflux, then yes, I would refer to rheumatology, but it depends on the patient. Yeah.
Awesome. Our time's up, which is crazy. Do any of you have any closing remarks that you would like to say that we maybe didn't cover, or that you thought about as we were going, that you think it's important to be on the recording?
The only thing I would say is that, a lot of times patients will have a lot of like different things going on, and they wait for their annual exam once a year to come in. And I hate that. Don't suffer for 12 months. If you're having an issue, again, my chart, come in for a visit, talk to us about things. Don't feel like you're only allowed to come here once a year.
Yes.
Yes. Quality of life.
Yeah,
Of life.
100%.
Yeah, and I just definitely want to emphasize, especially about that topic of fecal incontinence. it's not a normal part of aging, or if you're suffering from it, don't be afraid. We're here, you know, we can sit, discuss it and figure it out. And, you know, we're here for you. So definitely don't suffer in silence, you know. So that's the big message I'd like to give out. Come and see us.
Absolutely. The doorknob questions asked at the beginning of the visit. That's what I ask.
When you open the door, say,
open the door and ask the
I'm
question.
here. Tell me how to feel better. You don't have to sing. That's just me being annoying. All right,
Thank you, Nicole.
first of all, thank you so much. You
Yes.
are all brilliant and wonderful. And thank you to all the participants. The fact that you came and watched and submitted questions and learned, and being here is the first step to feeling better. So make sure you give yourself kudos. And a recording of the session will be emailed to you next week. If you'd like to schedule an appointment with Virtua Primary Care, go to virtua.org/primary-care. To schedule with a Virtua gastroenterologist, visit virtua.org/digestive help. And if you would like to see one of our women specialists, you can just call 833-VH-WOMEN. Obviously, it is on the screen, so you can take a screenshot and it'll be included in the email that you get sent next week. Thank you so much for joining us. And these Real Talk sessions are just the best. And remember, tell yourself you're beautiful tonight. Have a great weekend and go birds.
Thank you.
Thank you, everyone.